So welcome students for this session on peritoneum. Okay, so all of you know peritoneum is just a serous membrane, like heart had a pericardium and lungs had pleura. Abdominal organs have peritoneum. Now what happens is, suppose you take a balloon like this and insert your hand inside the balloon from here. So then your hand is here. So now what happens is the balloon becomes like this. So this was true in case of lungs, heart, and very simple. Now here what happens in abdomen is, suppose this is the peritoneal sac. Then there are multiple things that intrude inside the peritoneal sac. And then there are some who don't. And those who are not, they are called as retroperitoneal. And those who go inside, they are called as intraperitoneal. Now, although called as intraperitoneal, actually they are just apparently inside the peritoneum, not exactly inside the peritoneum. And then there are some which are retroperitoneal. Now, if I want to list what organs are intraperitoneal and what are intraperitoneal and what are retroperitoneal. So how do I remember this? Just go and alternate. Stomach is intraperitoneal. After stomach comes duodenum. So duodenum is retroperitoneal. Jejunum, ileum is intraperitoneal. After that, comes cecum. Cecum, retroperitoneal. Then in the cecum is appendix, intraperitoneal. Then is ascending colon, retroperitoneal. Then is transverse colon, intraperitoneal. Then is descending colon, retroperitoneal. Then is sigmoid colon, intraperitoneal. And the next is rectum, which is covered by peritoneum from anterior aspect. Amongst the glands, liver is intraperitoneal, while pancreas is retroperitoneal. Okay, kidney, retroperitoneal. So this is how we remember. We go alternate. Stomach is intra, duodenum is retro. Jejunum, ileum is intra, cecum retro. Appendix is intra, ascending colon is retro. Transfer colon is intra, descending colon is retro. Sigmoid colon is intra, and rectum not exactly retroperitoneal, but yes, it is not covered by peritoneum from all the sides. Now, each of this peritoneum has a separate name. The name of the peritoneum covering. It is, we don't call it peritoneum at all places. When the peritoneum covering the stomach is called as omentum. So there are two, greater omentum and lesser omentum. The peritoneum covering the jejunum and ileum is called as mesentery. Entry is the word for small intestine. So enteritis means the infection of the small intestine. Covering appendix is mesoappendix. Covering transverse colon is transverse mesocolon. Then sigmoid, the mesentery covering sigmoid is sigmoid mesocolon. Okay. Of course, liver, there is no specific name, but then there are multiple ligaments of the peritoneum attached to the liver. So this is about which organs are intraperitoneal, which are retroperitoneal, and what is the name of the corresponding peritoneum. Peritoneum covering the stomach is omentum, covering the jejunum ileum is mesentery, mesoappendix for appendix, transverse mesocolon is the peritoneum covering the transverse colon, sigmoid mesocolon is the peritoneum covering the sigmoid colon. Now moving ahead with the orientation. Now here I am going to draw three diagrams for you. How the supracolic compartment looks like. This is a transverse section of the abdomen, and here is stomach. So this is stomach. So stomach is connected to the anterior abdominal wall by ventral mesogastrium and posterior abdominal wall by dorsal mesogastrium. Only in the foregut there is this ventral and dorsal mesogastrium. Otherwise, most of the midgut and hindgut only have dorsal mesogastrium. So this is stomach, ventral mesogastrium, and dorsal mesogastrium. Now, what is the next development? In the next stage, what happens is, this is stomach, and in the ventral mesogastrium develops the liver, and in the dorsal mesogastrium develops the spleen. So this is liver, this is spleen. Now part of the ventral mesogastrium running from anterior abdominal wall to liver is called as falciform ligament. Part of the ventral mesogastrium running from liver to stomach is called as lesser omentum. Running from stomach to spleen is gastrosplenic ligament. Running from spleen to the kidney. So this is the kidney. Running from spleen to the kidney is lino-renal ligament. Lino-renal ligament. Okay. Now, what happens is, this stomach to spleen, what we are seeing is in one plane, in one transverse plane. But actually, there are three structures which develop in the dorsal mesogastrium between stomach and spleen. So I am drawing a separate diagram for this. This is stomach, and this is spleen, and this is the gastrosplenic ligament, what we are seeing here. But also developing from this part is gastrophrenic ligament, which is going to the diaphragm. So this is gastrophrenic. gastrophrenic ligament. And also going down like this is greater omentum. That means from this portion, there are three things that are developing. One is gastrosplenic, another is gastrophrenic, and third is greater omentum. Greater omentum. Okay. Now the orientation of the organs further changes. Further changes. And this I am showing in this last diagram. So the liver comes to lie on the right side. This is the spleen lying here. This is the stomach. This is the stomach. This is the lesser omentum. It will be running to the liver. Lesser omentum. Here is the liver. This is the falciform ligament. This is the gastrosplenic ligament. This is lienorenal ligament. Now with this orientation, what happens is the peritoneal cavity now gets divided into a larger area, which is called as greater sac, and the smaller area and a smaller area behind the stomach, which is called as lesser sac. Another name for lesser sac is omental bursa. Omental bursa. So that why bursa? Because the stomach gradually, whenever we eat, eventually it every time it increases in size, so that it doesn't have friction with the other organs. There is this space where the stomach can expand. So this and there are structures forming stomach bed, and between the structures forming stomach bed and the stomach is lesser sac, except for spleen. Spleen also forms a stomach bed, but it is separated from the stomach by greater sac. Okay. And here is the foramen. Here is the foramen, which is connecting the greater sac from the greater sac to the lesser sac. So this is the orientation of greater sac and the lesser sac. Okay. And this foramen is called as epiploic foramen. Epiploic foramen. Okay, epiploic foramen, which through which the greater sac communicates with the lesser sac. So this is the horizontal orientation of the peritoneum in the supracolic area. In the infracolic area, it is quite simple. It is very simple. In the infracolic area, you have to just draw something like this, and okay, this is the small intestine, this is the mesentery. Okay. So of course here there will be some ligaments like obliterated umbilical artery, the median of umbilical ligaments, the median umbilical fold, and the lateral umbilical folds. Okay. So this is the horizontal orientation of the supracolic and the infracolic compartment of the horizontal orientation of the peritoneum. Now let us see the vertical orientation. How is the vertical orientation? Now what I'm going to draw for you is a kind of a sagittal section. So what we saw previously was a transverse section, and now we are seeing the sagittal section. So in the sagittal section, this is the liver. Okay. And the peritoneum, as it covers the liver, it comes here, comes down like this. Now this is the anterior part, goes to the stomach, and from stomach, so this will be called as running from liver to stomach is lesser omentum. Okay. And then covers the stomach. So this is the stomach. And again unites at the greater curvature. Now this now is called as greater omentum. Okay. This is sometimes called as layer number 1, which continues as 4. This is 2, which continues as 3. Then this goes to the posterior abdominal wall. Okay. So now this red thing what I have drawn for you is the diaphragm. This is the diaphragm. Now the thing going to the posterior abdominal wall, and here is pancreas, and this is the anterior border of pancreas. And from the anterior border of pancreas, a fold goes like this. This is called as transverse mesocolon. Transverse mesocolon, and this is the transverse colon. Transverse colon. Again, it goes to the posterior abdominal wall, and then comes here as mesentery. So the posterior abdominal wall is here. Okay, so this is small intestine, and this is mesentery. Then it goes down. Now, depending upon, now let us consider this, what I'm drawing is a male. So the urinary bladder is here. Okay. Urinary bladder is here. The peritoneum will cover the urinary bladder, and the rectum anal is here. So it will cover the rectum. And here will be a pouch called as recto vesical pouch. Okay. In case of females, this will be divided, and here will be the uterus like this, and there will be two pouches, and this pouch will be called as the uh, uterovesical pouch, and this will be called as rectouterine pouch. In case of female, there will be three pouches. In case of two pouches, and in case of male, there is rectovesical pouch. Now this area, entire area is called as greater sac. And what is behind the stomach is lesser sac. So lesser sac is here, and greater sac is here. Now what is this? These are the infradiaphragmatic spaces. Okay, these are the infradiaphragmatic spaces, uh, also called as subphrenic spaces. So today, whenever you are dissecting, what you have to do is put your hand like this above the liver. So this you will find one space, and if you put hand behind the liver, you will find the second space. Now, thing is, there are four such spaces. Now I will tell you why there are four such spaces. Because when you will see the liver from the anterior aspect, when you will see the liver from the anterior aspect, this is the liver. So the peritoneum covering the anterior abdominal wall comes, unites like this, goes to the liver, covers the liver. It goes on the superior aspect, turns like this, goes behind, and again comes back. Okay. So so it goes to the liver as falciform ligament. And because of this, there will be one space here, like this. And behind also there will be two spaces. It is seen better on a cadaver than to be drawn. Now, how is the orientation of the liver on the posterior aspect? The liver on the posterior aspect looks something like this. Okay. Now, what are these lines I have drawn? These are lines of peritoneal reflection. That means the peritoneum covering from the anterior aspect will come here and gets reflected below the diaphragm like this, and then goes on the anterior abdominal wall. Peritoneum coming here gets reflected like this. Peritoneum coming covering the liver comes here and gets reflected like this. Okay, this will get reflected over the kidney. Okay, this area gets reflected over the kidney. This area goes like this. That means, and this L shaped, the peritoneum covers the liver completely on the anterior aspect, comes on the posterior aspect, covers. So what is drawn here, only area is not covered by peritoneum, otherwise everything is covered. So it comes here like this, and this L shaped way, from here it goes to the stomach. Okay, so this L shaped, from here the lesser omentum starts and goes to the stomach. So stomach will be somewhere here like this. It will be going to the stomach from here. From here it gets reflected over the kidney, and that is called as the hepatorenal pouch. That is called as the hepatorenal pouch. So the space here will be left anterior, behind here will be left posterior, this will be right anterior, and this somewhere here will be right posterior space. Okay. The left posterior space, because this is the lesser omentum, and behind that, so lesser omentum will go like this, and behind that will be the left posterior space, which is nothing but lesser sac. And right posterior space, which gets reflected over the kidney, is nothing but hepatorenal pouch. Okay. So I'll draw another diagram to show you how the hepatorenal pouch looks like. So suppose this is the liver, peritoneum covering the liver comes like this, and from here gets reflected on the kidney. Of course, in front of the kidney will be duodenum. This is kidney, duodenum, and colon. So this is the Morrison's pouch, or hepator. This is a sagittal section on the right side. Okay, parasagittal section. Morrison's pouch or hepatorenal pouch. What is the significance? When a patient is lying down after the operation, okay, and this is the liver, and then is getting reflected over the kidney. So this is the kidney, this is liver, this is kidney of the patient. So this pouch becomes like a dependent area. So all the secretions, inflammatory secretions, they come to lie in the hepatorenal pouch or Morrison's pouch. And that is one reason many times after the operation, the patient is given a propped up position like this, semi propped up, at angle of 45 degrees, so that fluid doesn't accumulate in this area. Okay, that is the significance of the Morrison's pouch. So there are four subphrenic spaces which are extraperitoneal, and there are few intraperitoneal. There are four subphrenic spaces which are intraperitoneal, which are called as the left anterior, left posterior, which is lesser sac, the right anterior and right posterior, which is hepatorenal pouch, and the extraperitoneal spaces. This is called as the right extraperitoneal space, and this is called as the left extraperitoneal space. Okay, there are two extraperitoneal spaces. Now talking a little bit about each peritoneum. The stomach is like this. So here comes from the liver, coming from the liver is lesser omentum. It covers the stomach. Again, the two layers are there. The two layers will come like this, cover the stomach, unite at the, again unite here. So these are two layers. One layer will go on the top, other layer will go behind, and then again they will unite, form greater omentum. So this is lesser omentum, this is greater omentum. Okay. So this is how the peritoneum of the stomach is. Now, as regards after stomach, the stomach ends like this. Then there is duodenum, and duodenum goes like this, and this here it is the fourth part of duodenum, and just after that starts the root of the jejunum ileum, and from here running like this on the posterior abdominal wall. The way I have drawn the line actually is the root of mesentery, from where the two layers of the mesentery take origin, and they will cover the entire small intestine. So when you look, you reflect the small intestine down like this, you will see how it is attached to the posterior abdominal wall, which is called as root of mesentery. Okay. Now in this one particular diagram here, I had drawn transverse colon here. But actually, when you will open the anterior abdominal wall, you will find the transverse colon here. So what happens is this transverse colon is so freely movable that actually we see it somewhere here, even in front of stomach almost. Okay. Anatomically, we don't describe transverse colon as the anterior relation of stomach, but because it is movable, it can be seen here. Okay. And these layers get fused. Okay. All these layers get fused. So now coming to the applied anatomy of the peritoneum, the last component, and applied anatomy is peritonitis. Like there is pericarditis in case of liver, and pleuritis, pericarditis in case of heart, and pleuritis in case of the pleura surrounding the lung. This peritonitis is more dangerous than both of them, because if there is peritonitis and all organs are connected to each other by the peritoneum, and therefore this can be very dangerous. Therefore doctors have to be very careful during the abdominal operations, because if one organ gets infected, all the other organs can get infected, because it's the peritoneum which is connecting all the organs. Okay. And then there are the small mesoappendix, transverse mesocolon, sigmoid mesocolon. These are other small peritoneum which you all can visualize during the. It is better seen in the cadaver than explained, but this is a general idea. So what students should ideally do during the dissection is, once they open the abdominal cavity, see the liver, put their hand on the superior aspect, feel for the left anterior and the right anterior space, go behind the liver like this. Okay, feel behind the liver like this and feel the Morrison's pouch. Okay, and also go behind the liver like this and feel the right free margin of the lesser omentum. Put the finger in the epiploic foramen and go into the lesser sac. This will orient you. This will orient you to the lesser sac. You will see the epiploic foramen. You will see the lesser omentum running from stomach to the liver to the stomach. You will also see transverse colon, transverse mesocolon. Okay, and reflect the entire small intestine and see the root of mesentery. Thank you. Thank you so much.